Not everyone needs the same volume, intensity, or progression. What they need is the right input at the right time. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. If you've been doing everything you think you should after knee replacement, showing up for therapy, doing the exercises, putting in the effort, but you still notice walking feels kind of off, stairs take more effort than expected, or your confidence hasn't returned the way you anticipated, then this episode is for you. Today we're talking about quadriceps weakness and why understanding it explains so much of what you may be noticing after knee replacement. When people think about recovering from a total knee replacement, they usually imagine strength as something you earn through effort. You do the exercises, you push through discomfort, you show up consistently, and strength comes back. For some people, that story mostly holds true. For others, something else happens. They do the exercises, they follow the plan, they're committed, and yet their progress slows. People often notice subtle changes in how their leg moves, especially when walking longer distances or navigating stairs, and they may find themselves thinking more carefully about each step. Confidence builds a little more slowly than anticipated, and underneath all of that frustration is a contributing factor many patients were never aware could play a role, and that's quadriceps weakness. By the end of this episode, you'll see why progress often slows even when you're doing everything right, and how understanding what's happening with your quadriceps can help you move forward with more confidence and control when you walk, climb stairs, and use your knee day to day. I want to start today by putting words to something many people notice, but rarely hear explained. If you feel like your progress after a knee replacement has hit a wall, it does not mean you've failed. It does not mean you didn't work hard enough. Very often, it means the right problem hasn't been identified yet. The quadriceps are a group of 4 muscles located on the front of the thigh. Together, they straighten the knee, control the knee as you lower yourself down, and help support the leg during weight-bearing activities, like standing, walking, and climbing stairs. And because of that role, any change in how the quadriceps function shows up quickly in everyday movement. Changes in how the muscle contributes can alter how you load the knee when you walk, how steady you feel standing up from a chair, and how much you trust the leg when stepping down or changing direction. What often gets missed is that the quadriceps weakness rarely starts at the moment of surgery. For many people, it begins before surgery due to chronic swelling, pain, limited range of motion, and reduced activity. When the knee cannot fully straighten, the quadriceps cannot contract efficiently, and over time, this leads to disuse and progressive weakness. After surgery, this problem is almost guaranteed to intensify. Post-operative swelling, joint trauma, and early loss of knee extension send powerful signals to the nervous system that suppress the quadriceps activation. This process is known as quadriceps inhibition. This distinction is important because inhibition is not simply about muscle strength or effort. It reflects a protective nervous system response that limits how fully the muscle can turn on, even when you are trying your hardest. During surgery, the body experiences trauma. There is surgical swelling and pain, changes in joint pressure, and altered sensory input from the knee after surgery. All of these factors feed into the nervous system. And when the nervous system senses threat or disruption, one of its protective strategies is to dial down muscle activation around the joint to reduce load and perceived threat while swelling and sensory input are high. This is not a conscious choice. You cannot will your way out of it by trying harder. A recent 2024 clinical commentary by Arjos and colleagues in the Journal of Orthopedic and Sports Physical Therapy described how quadriceps activation failure can persist well beyond the early postoperative phase, even as pain and range of motion improve. The authors explain that altered sensory input and ongoing neural inhibition can continue to limit how fully the quadriceps contribute during functional tasks. This helps explain why some patients can perform exercises on the table, but still struggle when they stand up and move through the world. The muscle may appear strong in isolated testing, but fail to contribute effectively during real-life movement. This explains why quadriceps weakness, especially when paired with inhibition, changes how you move. When the quad doesn't fire well, the body looks for help elsewhere. You might rely more on your hip, shift weight to the other leg, shorten your stride, or stiffen your knee during walking. These compensations they're not signs of laziness or fear. They reflect the body's amazing ability to adapt, protect you, and keep you moving, even when the knee has been through significant stress and change. Over time, though, those same compensations can reinforce asymmetry, increase fatigue, and delay confidence. Large cohort studies and systematic reviews have consistently shown that quadriceps strength is closely linked to functional outcomes after surgery. Patients with greater quad strength demonstrate better gait symmetry, improved stair performance, and higher self-reported function. On the other hand, persistent weakness is associated with altered mechanics and slower recovery trajectories. This relationship isn't limited to athletes or high-demand patients. It shows up across age groups and activity levels, including older adults who simply want to walk comfortably and safely. What's especially important is that quadriceps weakness is not evenly distributed across patients. Some people regain activation quickly, others don't. Conditions such as diabetes have been shown to blunt functional gains after knee replacement, likely through a combination of metabolic, neural, and vascular factors. Pain sensitivity, swelling response, and preoperative deconditioning also all play a role. This variability is one of the reasons timelines can look so different from person to person, and that range is expected, and it does not mean something is wrong if your progress looks a little different from someone else's. And yet, many rehab programs default to a one-size-fits-all approach, unfortunately. Strengthening is prescribed, repetitions are counted, resistance is increased, and progress is assumed. When improvement slows, it's often unclear what to do next, and patients are left either pushing harder or wondering if therapy has run its course. But pushing harder on an inhibited system doesn't always produce better results. In some cases, it increases frustration and reinforces compensatory movement patterns. This is where clarity becomes empowering. Once you understand that quad weakness after knee replacement is often a nervous system problem as much as a muscle problem, the conversation changes. Loading the muscle is certainly important, but sometimes the focus also needs to shift toward re-engaging it in movement. Quality becomes more important than quantity. How the quad turns on has more influence than how many repetitions you complete. This is why some patients feel stronger on paper, but still don't really trust their leg. The connection between the brain and the muscle has not fully recalibrated yet. Clinical research has shown that interventions targeting quadriceps activation early and deliberately can improve outcomes. This includes focused motor control work, intentional cueing, and in some cases, adjunctive tools designed to bypass inhibition and facilitate muscle recruitment. In simple terms, muscle recruitment refers to how many muscle fibers the brain is able to turn on and how well they turn on together. Muscles are made up of thousands of small fibers, and those fibers are organized into groups called motor units. When your brain wants to move, it sends a signal that recruits motor units. First a few, then more as greater effort is needed. After surgery, that signal can be dampened, meaning fewer motor units are recruited and fewer fibers contribute, even though the muscle itself is still there and the muscle tissue is still capable. One of the most studied of these tools is neuromuscular electrical stimulation, or NMES, a topic we'll explore in depth in the next episode. But even without getting into specific technologies today, I want you to take away this central idea. Progress doesn't slow because you're not trying hard enough. It slows when the strategy no longer matches the problem. If your quad feels unreliable, if your knee feels hesitant during walking or stairs, if fatigue sets in quickly or confidence has not yet returned, it's worth asking a different set of questions. Is the muscle truly activating? Is it contributing during functional movement? Is swelling or pain still inhibiting the nervous system? Are compensations masking the underlying issue? These are clinical questions, not personal failures. In my work with knee replacement patients, I start by focusing on how the movement is happening, not how much weight someone is lifting or how many repetitions they're doing. Early on, the priority is activation and movement quality, even when patients are eager to add resistance. As movement patterns improve and the quadriceps begin contributing more reliably, loading and strengthening become much more effective. And that's when increasing weight and repetitions truly start to pay off. This perspective is supported by expert consensus in rehab research, which increasingly emphasizes individualized, preference-sensitive care after knee replacement. Not everyone needs the same volume, intensity, or progression. What they need is the right input at the right time. And as we close today, I want to talk directly to you if you're feeling discouraged. If things haven't followed the script you expected after surgery, you're not alone. Quadriceps weakness is common and complex, and it plays a major role in how well you walk, use stairs, and regain confidence after knee replacement. And it can be addressed when properly understood. In the next episode, we'll build on this foundation and talk about how NMES fits into a comprehensive recovery plan, who may benefit most, and why it's not a shortcut, but a support when strengthening alone isn't enough. And before we wrap up, I want to tell you about something I've been building called the Total Knee Replacement Game Plan. It's a prehab-focused educational resource designed to help you head into surgery feeling stronger, better prepared, and clearer about what truly influences outcomes after knee replacement. If that sounds interesting, you can sign up to be notified when it's released by visiting the show notes or going to totalkneesuccess.com. As you reflect on this episode, remember that understanding what's happening in your body gives you leverage. When you can name the problem, you can choose better strategies, ask better questions, and move forward with purpose. You've got this. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.